Each year in the last 10 years, between 150 and 200 amputations have been performed at the Queen Elizabeth Hospital, the majority associated with diabetes. In an effort to significantly reduce these numbers, government has embraced an initiative spearheaded by the International Diabetes Federation, which places emphasis on the diabetic foot.
We in Barbados know that we have a problem with diabetes with respect to the number of diabetics that we have in our population and also the number of amputations that we've been seeing in our diabetic population. Research has shown that this has been largely due to lack of education, one, in the patient, and persons not, even if they know what they're supposed to do, not practicing what they're supposed to do. And there's also some lack of knowledge in the healthcare worker with respect to looking at the foot and examining the foot in diabetics and paying attention to the diabetic foot.
The step-by-step program seeks to address these issues by training health professionals to recognize early signs of foot problems in diabetics. The training was carried out by medical volunteers of the International Diabetes Federation.
It consists of two courses. A basic course which introduces the diabetic foot. It introduces the basics of screening and staging the diabetic foot, because a lot of us don't realize that the diabetic foot should be staged. Just because you're diabetic doesn't mean your foot is numb. Just because you're diabetic doesn't mean your foot doesn't have a good circulation. So we need to know which one you are, because which one you are helps to detect on how we should manage you afterwards. And then basic wound care techniques, and just mainly an introduction to the program. Implementation of screening tools like using of a tuning fork and using of a monofilament in order to screen that foot and help you to stage that foot. And then the advanced program is then where you take it a step further and we go into once we've staged and we've identified these people, what are some of the other things that we can be doing for them? If they have poor circulation, what are the other tests that they should have done? And at what point shall they do this?
Once the healthcare workers were trained, implementing the program in polyclinics around the island became a priority for the Ministry of Health.
If we do not look at our patients' feet and pay attention to the fact that the diabetic can have, because we know the diabetic can have neuropathy, which is loss of sensation in the foot as part of the natural history of that disease. And with that lack of sensation, we know that the diabetic foot, makes that person not being able to feel when they have a nail puncture, or feel when how hot or how cold something is. And even when they put their foot in the shoe, if the shoe is not well fitted, they can't feel if the shoe is too tight, or if there's an area that can cause irritation to the foot when they put their foot in the shoe. Those are some of the things that make the examination of the diabetic foot by the healthcare worker and the patient very important.
As a result, since last August, every diabetic patient visiting a polyclinic has been assessed, with special attention being paid to the feet.
So when you come into the polyclinic, you as a patient will go to the nurse's station, where the nurse will call you as part of the normal process. When you go to the nurse as usual will take your normal vitals, your temperature, blood pressure, etc. She may even do your DAS scan as part of the process. When you get to her, she will have a form where she will ask you specific questions. And these questions will be targeted at looking at your foot and your foot care and your history of foot care and any foot care problems that you would have had.
And the form is asking, I can go through it with you, is there any history of foot ulcer? And my answer on the right foot is no, left no.
She will ask you to take off your shoes and your socks if you're wearing socks or stockings or so forth. And then she will look at your foot. She'll be looking at the shape of your foot. She will look in to see if there are any deformities of the toes of the feet, because deformities might be saying, you know, although I'm wearing an enclosed shoe, that shoe is pinching some part of the, probably usually the upper part of the foot, and that is making my toes all scooshed in and badly shaped. The nurse would also educate you about proper foot examination. She will tell you how you should be examining your feet on a daily basis. And when I say examine your feet, because when you tell patients to examine their feet, and you ask them, so how do you examine your feet? They might take their foot and just say, I look at it. That is not what we want. We want that when you examine your feet, you are looking at the top and at the bottom. And if you cannot see the bottom of your foot because something's difficult to get your foot up, you can use a mirror and look at the bottom of the feet, because that is where most of the injuries that a diabetic will sustain will occur, at the bottom of the foot. So the nurse will educate the patient about all the things they need to look at in terms of foot care and footwear.
The patient is then turned over to the doctor, who will continue the assessment process.
By mainly examining the foot with 10-gram monofilament and actually feeling for pulses, testing for the 10-gram monofilament for the sensation, right? I just want to say here that I have differentiated nurse and doctor, but these practices that I'm telling you about, both the nurse and the doctor are capable of doing the full, complete examination of the foot using the 10-gram monofilament and the feeling of the pulses and the other areas of examination. That is why it was important that we trained the healthcare workers, and they've been fully trained in that aspect. So because of resources to maintain the flow in the polyclinic, you might see that the labor is divided, where the nurse might start the process and the doctor continues, or the nurse might do the entire process, or the doctor might do the entire process. It depends on the clinic that you go to and the system that they have implemented. But the important point is that when you come as a diabetic with an appointment to the polyclinic, you will have a foot examination by your healthcare provider, be it a nurse or the doctor.
After the examination, the foot is assigned a risk category, which may vary from 0 to 4. This categorization determines how the foot would be treated going forward.
Based on what your risk assessment is, the healthcare team, because it's very much a team approach, will say, okay, your risk category is 0. Your next complete assessment would be in a year's time, an annual review. That does not mean that if a person identifies a problem or sees a problem with their foot, that they're not supposed to, one, tell the nurse, tell the doctor. And I don't even mean you wait for an appointment. You don't have to wait for an appointment. If you notice a problem with your foot, you come in before your appointment time and you say, I have noticed a problem with my foot. Because the earlier you identify something and the earlier that you come for the intervention, the better it is for you to decrease your risk of going towards amputation. That is what we're trying to stop, the number of amputations that we're having.
Educating the patient is an important part of this new initiative, since it is recognized that the more information people have, the better able they are to manage their disease.
Diabetics need to understand that, one, they must examine their feet on a daily basis, and they must pay attention to the shoes that they're wearing. And I know that one of our common practices is that if you're just going out in the yard, we're going barefoot. That is a practice that needs to stop. Because when you do that, your risk for getting injury has increased. And when you have an injury, even though because things can happen, even though you try to prevent as much as possible, anything can happen. And if you have an injury, do not try to tend to it yourself. That is not what we want. Don't do it. Come and seek professional attention at your earliest opportunity, which should be immediately if possible, because we need to get that foot from going on to infection and amputation. Okay? So that is the message that we are preaching.
The program was launched in Tobago and has been adopted by several other countries in the Caribbean and Africa. Its impact so far has been encouraging.
In Tobago, they had a reduction in amputations. And in Tanzania, which is the only one that's been documented and published, that published paper shows a 50% reduction after a 5-year period. Now, what initially happens is because you're screening, we now pick up all of the diabetics, and we have a very good idea of who is out there and what stage they're at, whether they have a numb foot, whether they have no circulation in their feet, etc. So initially the numbers go up, and then the numbers come right back down, and it showed a 50% reduction. So it's across the Caribbean, because we also recognize that there are approximately 20% of persons who are diabetic that become afflicted with a foot problem. And in Barbados, we're well documented, so we have a very good idea as how many amputations we have, as it relates per capita. But across the Caribbean, they're not as well documented, but it's relatively well known that they too have a lot of foot problems.
The Ministry of Health is doing all in its power to ensure the successful implementation of this program across the public health sector in its efforts to reduce the number of amputations and the high costs associated with them.
We understand that we need to pull the management of diabetes, and particularly that of the diabetic foot, out of the tertiary care setting, which is the settings like the QEH, back into the primary healthcare setting. And in order to do this, we need to build our management teams and make sure that our healthcare workers are armed with the knowledge as to how to properly manage the diabetic foot and to prevent persons from getting to the stage where they have to go to the tertiary care setting, where most likely they will end up with some type of amputation.